Speech Perception and Comprehension by Haley Wingo. Detection is simply put the ability to recognize sound. While detection cannot be taught, it can be helped. If the patient has hearing loss, hearing aids and cochlear implants can help. To assess how much detection someone has, it is best to present different sounds and ask if the patient can hear the different sounds presented. If someone uses sign language or any other form of physical communication, simply using gestures that is agreed upon by both people would work well to assess the question. So, for the assessment, we know that patients can hear at different frequencies, and so producing different sounds can let the therapists know whether or not they can hear high or low frequencies and what exactly words or sounds they're going to have trouble hearing. And this is going to be beneficial for therapy as a whole. Also, if they do use physical gesturing, then just asking and deciding on a simple yes or no gesture that is agreed upon by both patient and therapist will work just fine. Just so that way they can communicate as simply as possible. Discrimination. Discrimination is the ability to tell sounds apart. One way to teach this is to play sound games. The professional could produce different sounds, and the patient guesses if they are the same or different. If the patient gets it right, they get a point. One way to assess the patient's ability to hear different sounds is for the professional to produce certain sounds and ask if the sounds are different and allow them to communicate yes or no. They also can ask them to repeat the verbal sounds themselves. If the patient uses physical gestures, then the best way to teach them and assess them is using flashcards that have the words same or different written on them that they can point to during these events. So for the games, just simply having the sounds and asking different and just asking yes or no would work just fine. And then during the and then for physical gesturing, those flashcards will absolutely work well just by able to allowing them to point. Identification. Identification is the ability to tell the difference between different parts of speech, like individual letters, syllables, and graphemes. One way this might be taught is by repetition. By making the patient listen and even in some cases repeat the sounds, this will enhance memory. One way to assess discrimination would be for the professional to cover their mouth and to produce different sounds. Then ask the patient to repeat the sounds they heard or to point out the sound on a flashcard or a sheet of paper. If the person does not use verbal speech, identifying mouth movements for certain sounds would be a good way to help discriminate speech. Another way for assessment is to visibly show the mouth and allow the patient to point out the sounds written out for them. So if somebody is nonverbal, it is absolutely okay for them to be able to view the mouth if they have hearing loss for the assessment and also for the repetition, just allowing them to see the mouth movements and also to even help them repeat the movements. That way they can identify them on another person. This would definitely be beneficial for them. Attention. Attention is a fundamental ingredient in the perception of speech and relates to attending to or focusing on the speaker and the message being conveyed. One way to teach attention is through activities like storytelling. The professional should tell a story and then ask the patient questions. This would teach how to pay attention to main points and details in speech. One way to assess attention is to tell a patient a few sentences and then ask the patient in their own words what they heard. If the person uses physical gestures, the way to assess what the person heard can be through writing out details from the stories and the assessment. Memory. Memory is the ability to recall information that was told through speech over different times. This is important because fundamental to other components of speech perception and enables us to combine individual speech units for the purpose of deriving meaning from the entire verbal message. For teaching memory, one way is to describe an item to a patient, then ask them to find the object on the table. This makes the patient recall the details of the object. To assess memory, tell the patient a few words and then later in the session ask what the words were. If the patient is not able to use verbal speech, they would still be able to identify the objects for teaching. However, for the words in the assessment, the professional could hand a sheet of paper over that has many words written and ask them to point to the words from before. So, as you can see, they're able to use certain images and things like that that can help them identify details. So, this is just one way to do that. Um, to help with memory is to pick out that object that is being described. Closure. Closure is the ability to recognize the meaning behind a person's speech, even when certain elements or sounds are missing. One way to teach closure is to play a missing word game. The therapist would read or tell a story but would skip every couple of words. The patient would then tell what they think the story was about. To assess closure, a therapist might have the patient listen to a tape of different people having a conversation. The therapist would then ask what the two people are discussing. If the person is not able to use verbal speech for the game, then they can have them use a word bank that they can insert where the missing words would go in the story. For the assessment, they could use paper with multiple choice questions to the recorded conversation. As you can see here, this is an image of what would happen during the assessment, just listening to this story, and then later on asking them what it was about. Comprehension. Speech comprehension is the ability to understand the whole message in speech. For teaching comprehension, the therapist could play games, play Guess Who in reverse with the patient. This is where players can take turns giving clues so the others must listen, take the information, and eliminate correct characters on the board. Example, my player does not wear glasses. One way to assess comprehension is to read a paragraph and then ask direct yes or no questions about the story. If the patient uses physical gesturing, the game for teaching works well. The assessment would work fine as long as the patient and therapist agree on an appropriate yes or no signal. So, this is just a way that a therapist can play by, again, with the example, my player does not wear glasses. So, this would just be a fun way that they have to listen and understand what is being said, and also in a fun environment, especially for children. And these are my wonderful citations that I've used. Thank you so much for listening. I hope this was informative, and I hope you've enjoyed listening.